I'm pleased to welcome this morning Ann Albert and Diane Turner from Age Better here in Madison. I've known Ann for quite a few years. She's been a great partner with Triad. And Diane, I met her a few years ago when the Safe at Home program got started. I'm really pleased that they could join us today. Ann, let me turn it over to you. Talk a little bit about you two. Let us know you a little bit, and then go ahead and take off with the program, okay?
Sure. Thank you, Mike. Hi, everyone. It's nice to see you all here today. I am the executive director of Age Better, if we haven't met before, and Age Better provides the Safe at Home program. I thought I'd give a little intro and then introduce Diane, our Safe at Home program coordinator. So Age Better, if you're not familiar, is a nonprofit located here in Dane County. Our offices are at Oakwood Village, the West Campus, University Woods campus. We are a nonprofit organization, a 501c3. And we have two main programs, SAIL, our flagship program, Sharing Active Independent Lives, that started 20 years ago. And then the Safe at Home program, which is what we're here to talk about today. And that program officially started on January 1st, 2024. So Age Better, as I said, is a nonprofit. It was founded and is governed by two nonprofit life plan communities, or CCRCs, Oakwood Village and Attic Angel, located here in Madison. And both of those organizations founded what I mentioned is the SAIL program 20 years ago, and it's a wonderful extension of their ministries to older adults out into the community. So the members of the SAIL program, for example, are people who live in and around Madison in Dane County. And those two organizations have worked collaboratively in spite of the fact that they are obviously competitors, but they work together to provide many of the similar services and resources out into the community that you would find within their walls in life plan communities. So all about trying to help older adults stay connected, stay safe, stay active, and in many cases, hopefully remain in their homes that they love. So our mission is to help people remain connected, active, healthy. We want people to remain in the home that they choose and to also be able to live independently and live well. So the Safe at Home program, I thought I would give just a little bit of history about Safe at Home. Many of you heard of that particular program years ago if you're from Madison. It was part of the SSM Health organization. And in 2022, we learned that SSM Health had planned to close that program. And we contacted them knowing that it would leave somewhat of a gap in the community for older adults to receive home safety assessments. We contacted SSM Health at Home, and they provided us with basically all of the information about their program. They had operated the program for about 11 years, and it had been originally funded through United Way and most recently through SSM Health as an organization itself. It's a free home safety program for older adults living in Dane County, and it offers a free home safety assessment and follow-up services. I won't get into the nuts and bolts about the program itself and how it operates, as Diane will present that, but just as an example, just giving the example of how we started with a pilot program. we wanted to find out what we could learn. So in 2023, with the resources provided by SSM Health, we created a pilot program in partnership with Madison College. They have an occupational therapy assistant program. The instructors at the time, who is now retired, Darcy Olson, and her partner, Kayla Olson, who also taught at Madison College, worked with us to offer free home safety assessments in 2023, working with students. So the students went out in pairs. I accompanied them myself. I had the opportunity to do that. And we were able to provide about 40 home safety assessments during that pilot period. And we provided follow-up calls as well. That pilot then positioned us to be able to receive a contract with Dane County in January 2024 that allowed us to keep the program going. And we have a contract again this year, which is wonderful. So the contract funds a part-time program coordinator for Safe at Home, and that is Diane, who will be presenting. And it offers, some of the funds needed for outreach and things like that. So we are able to provide, last year we provided 86 free home safety assessments for older adults. This year we're definitely going to meet and exceed that, I'm sure, at the rate we're going. So it's a wonderful evolving program, and we're learning every day. The reason the program, I think, is a wonderful model that could be replicated in other communities is that the assessments are provided in partnership with schools, University of Wisconsin-Madison Occupational Therapy Program, Madison College Occupational Therapy Assistant Program, and retired occupational therapists and physical therapists. So we recruit and work with a wonderful team of volunteers who are actually out doing the assessments. And then we, the staff program coordinator, provides the follow-up calls to the participants. So it's a very comprehensive program in that we are providing an in-home assessment, but also then connecting the participants to various programs and resources in the community to make sure they can follow up on the recommendations that were given. So that's kind of the history of how we got started, the pilot 2023, the earning the contract in 2024, and this year, of course, and being able to, rather than reinvent the wheel, kind of take advantage of the wonderful resources we were provided through SSM Health, and we are certainly happy to assist other communities as well, as much as we can, if you're interested in that. So I see a lot of you here today. It looks like are from around the area and also throughout the state with various agencies. So feel free to contact us if you'd like some additional information or ask any questions. So I don't know if there's any questions right now regarding the actual startup and how we operate, or if we can move with on with Diane presenting. So open to any questions. If you do have a question, maybe raise your hand or ask in a chat.
And I was just going to ask since I've got the quick finger here on the unmute bar, I'm just wondering, there are a lot of people who could do this kind of thing, right? You could hire a remodeling person who has a grandma that is a little worried, right? You know, they know about grip bars and move your rugs and that kind of thing. Uh, this is a really comprehensive program. What kind of solution? I mean, not exactly solutions, but uh, how does this program, I mean, what kind of people are they really serving here? I mean, are these easy customers to deal with, or uh, sometimes challenging situations where, you know, you're not just providing advice on, you know, how to make it safe, you're really developing a consensus among people?
Yeah, I think Diane will cover a lot of that really well. Obviously she has the most exposure and the most experience, but I would say that our constant or our basic belief is that there's no one size fits all. So we all age in different ways. We all have different support systems or not. But definitely, there are some assessments we walk in and honestly, there's maybe one thing that we might see that needs to be recommended or changed. Sometimes it's amazing to me. Early on in our pilot, we provided some assessments, and sometimes I left the home thinking, I think if anything, it was just a really nice affirmation to that older adult that they have done the work and have done a wonderful job making their home safe. So, and then we walk into some situations where the list is long of things that need to be done and not always a lot of agreement. There's also times where we find with good intentions, a loved one might help and they may install something like the time I walked into a home in Verona and the person I put back the shower curtain and they were saying that they had grab bars and they had those suction ones and there was one lying on the bathtub floor. So, you know, it was a clear example of good intentions, but not really having the correct advice or the correct equipment. So we see it all, and Diane will, I'm sure, share some examples too. But thank you, Mike,
Okay, thanks.
for that. Okay, so Diane came to us in September of 2023 during our pilot, and we were very pleased. By the way, the pilot, we were able to do that thanks to some funding through the Madison Community Foundation. So if you are from another outlying area and you are thinking about, how to create something like this or get it started, we found the Community Foundation was very excited about supporting something to help older adults in their community. So that helped us get started. Diane came on board and then she accepted a permanent position with us in January when we launched our official program. So Diane has a long history working in the healthcare industry and social industry, social service. She has a, excuse me, a PhD in anthropology, and she has a number of excellent skills and assessment, and also what's been very helpful for us is many contacts and connections with underserved neighborhoods and places where we really want to help people become more aware of what we offer. So with that, I turn it over to you, Diane. We had a lighting issue, so we're sharing a screen today, and Diane will take over.
Good morning, everybody. I hope you are all well. What I want to do is tell you a little something basic about assessments. I mean, we're talking about home safety assessments. So I think we should stop and say, why the home? Because when you look at the number of falls, most falls occur for older adults in the home. And why is that? Well, because we spend a lot of time there. But there's another reason, and I think this is something that we need to attend to, and that is that in the home, you find your safe place. You know, outside can be fraught with issues for you, but when you come home, you feel safe. And also, you think that that space, you've learned how to negotiate. And so you have a false sense of safety. So we go into the home and do the assessment. Now, this assessment, Anne alluded to, comes to us using tested forms that started with the CDC many years ago. And the person who does the assessment is, by and large, an OT rather than a PT. And that form operates so that the OT will walk through every single room and passageway, look at the front of the door, steps to the basement, into the basement, the garage, any place associated with the home, because that's all important. What we have to suggest is that the participants walk with the OT through the home. And we do this because then the person, the participant, has a real sense of what the safety issues are. And that also is associated with another part of what we do. We make recommendations. The OT makes a recommendation and on a form that is given to the participants. Now, the best way to get this done is to have somebody really engaged in it, and going through the home with the OT does it. It's the kind of thing that happens when you go to a doctor's office. They say 2 pills. If you didn't want to go to see the doctor in the first place, the chances that you're going to take those 2 pills is slim, right? Okay. So after the form is filled out, the recommendations and given to the participant, then I follow up. And I follow up basically 3 times over a 6-month period. And we find out some very important things. We ask the person first, what did you think of the assessment? That gives us an idea of how they took in that experience. We ask them if they fell before the assessment. We ask them if they felt after the assessment. We ask them if they've acted on the recommendations. And I do this after about 2 weeks, after 3 months, and after 6 months. So we not only are getting feedback, but we can then share that information, finding out why, when, and where people fall. Now, I've talked about the person who gets the assessment as the participant, and that's how we view this arrangement. They come in, they are engaged in it, and they participate in it. It's a best way to learn and to get someone to act on their own best interests. Now, this follow-up I do, right, 3 times. But I have to tell you that one of the benefits of our program is that the OTs also follow up. They sometimes go over and beyond the actual assessment. And I just got this yesterday, so I'm gonna read a couple of sentences to you because I think it's really telling. And this is a quote. The OT asked me, are you in tomorrow, or can I stop in and get a few envelopes of the stick-on rug grippers? I saw this person today who needs some. Also, sending her sample of rug grip material for under the rug. These are small rugs that she can't get rid of or she slips on the linoleum. Her feet are very sensitive and she can't tolerate shoes or socks with the grippy bottoms, end of quote. So our orientation is ongoing. All right. Now, one of the things that I have been paying attention to as I have been doing this job is that we focus on the person who gets the assessment. And that is something that I want to stand back and kind of take a look at. You know, when we focus on one, that puts that person in a category. And I think that this is part of the way we in this society think, right? We quantify things. And if I can move a couple of screens here, I want to show you something.
That's on right now.
No, I want to show the next couple of screens.
Okay.
Okay. Okay, I'm showing you screens of the kinds of things that when we talk about falls and fall prevention, we focus on, okay? How many falls? Can I go down? Thank you. And we talk about, you know, where people fall, risk factors, percentages, and what can be done to prevent falls. We categorize things, we limit things. And this, I think, is something that we should rethink, right? Because people really don't fall alone. Their falls affect other people, right? And that is something that's missing from our attention. When someone falls, somebody has got to come in and do some things for them, right? They have to sometimes come in and they have to do housework. They have to run to the store and get groceries. But there's something else that occurs, and that is the emotional response of other people to one individual's fall. I have done a number of presentations with Deputy Chief Jeff Dostalek, who's from the Fitzrona Fire Department, and he talks about his experience, his feelings regarding his mother's fall. And this is something when we often look at the literature, we don't pay attention to. And that, I think, has some really strong effects on how we go about our work. The other thing that happens with folks that I'm hearing is that they wonder how long a person's going to be incapacitated. And are they going to fall again? What does this fall mean? So other people are invested in one person's falling. So if we only focus on that one person, we are losing sight of important things, right? The kinds of people that ask for assessments. Now, while we're focusing on one person falling, assessments are called for by other people. You know, social workers, nurses, doctors, relatives, friends, neighbors. So again, we're seeing this person being embedded in a social network. And the meaning of somebody's falling and the meaning of getting an assessment is a little more complicated than we might first consider. Sometimes children want to have an assessment done. And they receive different kinds of responses, not just from the person for whom they want to do the assessment, but from other relatives. You know, when you call for an assessment, when I talk to folks about setting up a time that an OT can come out, I am dealing sometimes with some unpleasant, difficult, troubling, puzzling relationships, because you have, for example, children who have a different relationship to their parent for whom they want to do the assessment. You may have to deal with someone who is the POA for health, and that sets that person sometimes against other siblings. That's an issue that comes into the process of establishing an opportunity for a home safety assessment. Sometimes children call in for assessments while they're living in another state. This adds to the potential difficulty of getting things organized. Sometimes we have a situation, and I've dealt with this a couple of times already, where the person for whom you want to do the assessment is aged and frail, and yet is in a caretaking position for an adult child with a disability. And so when you're doing the home assessment, all these things have to be taken into consideration. Sometimes all the children want to be in the home for a parent's assessment. And this adds to, I'm going to use the word in quotes, the excitement of doing the home safety assessment. And sometimes the parent only wants one child to be there. So while this seems like a straightforward home safety assessment for one person, it's often not the case. I have also received requests to do a home safety assessment from a friend or a neighbor because this person has been more in contact with the older adult than the adult's own children. And sometimes that situation is met with some amount of resistance by the participants' children. In one particular case, a son was rather put out by this neighbor who asked for the assessment and said, I don't care what you do. I'm not following up on these recommendations. I didn't ask for the assessment. You're overstepping your bounds. And so what do we do? Well, as it turned out in that case, that man's son talked with the neighbor and said, I want to help my grandmother. I didn't understand what was going on in her life. I didn't understand what kinds of, frailty she had or how potentially unsafe her situation is. I'll work with you. Can you advise me? And that's what happened with a friend. And so you can see the complexities that can be involved for one person. Now, an assessment sometimes has an unexpected outcome. Sometimes people who have been on the outs maybe or not seen one another, after the assessment has been done and it's clear what kinds of recommendations should be implemented to keep the older adults safe, it functions as a mechanism for creating a team and the opportunity for teamwork, which is not often what you would expect, right? So sometimes it brings families together. Sometimes it gives it an opportunity to display the structural problems in a family. So assessments can give perspective on someone's condition that a family can act on. Now, not everyone wants to have an assessment. Sometimes you get the participant who doesn't want to have anything to do with this situation. One of the reasons for this is that they hear the word home or the words home safety assessment, and for them it says, you want me to get out of my house. You're going to use this to drive me out of my home, and I'm not going to allow that. And so then what happens is that the OTs, the family, as best we can, make the statement to the older adult, no, we're doing the assessment to find out what can be done to keep you safely in your home. We want to do what we can to keep you there if you want to be there, if you can be there. Now, there are times when that's not an option. So then the assessment can be used as an objective, I'm using this in quote, objective statement of why someone should obtain other kinds of housing. It takes the onus off of the children, for example. It's clear that a trained professional with the best of knowledge and motivation has made a statement to keep the older adult safe and maybe someplace else. Now, what I have heard is that people will say, you know, my mother didn't listen to me. But when the OT came in and said exactly what I said, it turned the tide. It's the third party, the person who's not been involved for a whole lifetime in terms of relationships, who could make the point about making changes in the participant's home. One man said to me, you know, when the OT came in and she wanted to find out what this dad's ability was to safely get in and out of chairs as one of the ways to look at what the issues are for him. He said to me, my dad wouldn't get out the chair. My dad denied the need to get out of the chair. So we have accumulated all kinds of information about home safety assessments and about the utility for the assessments, the complexity for the assessments. And we want to make the point that we are dealing with not just one person, even though when we look at the literature, when we look at the research, when we look at the forms and the statements, it's about more than one person. I want to pause here and ask if you have any questions of me.
Diane, I saw a comment from Ashley at Safe Communities. She brought up the idea that maybe you need a psychologist on your team. An anthropologist, of course. I mean, and I'm sorry, I didn't realize you're a PhD, Dr. Ann. You know, this is a complicated problem, right?
You know what? Ashley, hi, I think you've got a point. You know, and I'm going to have to tell you, it's the anthropologist in me that made me look at all the things that I have been looking about, that, you know, all the numbers, risk factors and places and how often and percentages, and said, there's something here that's just not right. What's missing here? And what's missing here is the fact that it's not just one person that we're dealing with in terms of the fall, all right? I want to tell you that Anne did something really interesting the other day. She took my first draft of what I wanted to say and she ran it through a chat, an AI chat, and so it brought out this nice, elegant, little outline. I thought, well, that's kind of interesting. And what it ended with is something that I want to share with you because I think it says something really important. So just give me a couple of minutes here to read this verbatim. A fall may physically happen to one person, but it emotionally, logistically, and socially affects many. Acknowledging this shared experience could make fall prevention more compassionate, effective, and widely supported. End of quote. And you have something that you want to add here.
Oh, I think that I just wanted to add that one of the very simple strategies or comments that has helped sometimes when Diane mentioned that sometimes there's a fear of losing independence and taking on an assessment and having someone go through the home is that when we contact the person, we always stress that we're calling to, schedule an assessment, and everything that we're doing is all about helping a person protect their independence. And that's really what this is all about. Trying to make sure people are understanding that, our interest is to find solutions, to find ways to help protect independence, to make the home safer. And the work of the OTs and the students is all around that. Certainly, we can provide some objective findings that could help generate a conversation for future planning. And we find out later that often has been a catalyst to help people get started in that thinking of, would there be a more supportive environment that would help me stay independent? But most of the time, people are really appreciative to just have some adaptations or have some tips and tricks on how things might be done in the home safely and help people protect their independence and stay there as long as they can. So, any questions at all from anyone?
I got to wondering how much, if you have a figure on how much it costs Wisconsin, in aggregate, in medical costs as a result of falls. I mean, I was looking here at CDC data, and it said over the whole country, $50 billion is the cost of falling down, in terms of medical costs. And Wisconsin's not, we have a lot of falls, but not among the highest. Some places are falling even worse than us, So how much does it cost here if you would have an idea here in Wisconsin?
I would differ that, Ashley, I don't know if you have that number on hand. I don't want to put you on the spot, but if you don't, I would certainly encourage people to visit Wisconsin Institute for Healthy Aging. They have a statewide Falls Free Dane. If you're not familiar with that organization and you're living outside Dane County, especially, they have a wonderful resource for falls prevention, and they have fact sheets and so forth. I can't see the chat, Mike, if there's any comments.
Ashley said she's in a car and unable to follow up right now.
Oh,
But,
okay.
that shows the dedication. We love Ashley. She's been helping us for quite a
Yes,
few
yeah.
years.
And that's a great resource. I really hope people will, if you're not familiar with Wisconsin Institute for Healthy Aging, you can find it on the web, on the internet. It's a Madison-based but statewide organization, and all about healthy aging. And they have a special program called Falls Free Wisconsin. And we all work collaboratively with also Safe Communities here in Dane County. Both organizations are a wonderful resource with facts and information, and also strategies, evidence-based classes people can take to improve balance and prevent falls, along with listings of community resources and so forth. So yeah, it's a good question, Mike. I know it's, we know that we lead the country in deaths from falls, and, in Wisconsin. So that's a huge cost, obviously, too, when we talk about lives being lost because of falls.
And investing in this kind of program, I think, I mean, even if Wisconsin is only 1/50th of the 50 billion, that's a huge cost that's often borne by society at large. It's not the individual who falls down who's paying. to get fixed up, so this is a small cost to try and get this program going, I think.
It's a good point that you make there, Mike. I guess what you said made me think about something Diane brought up the other day too, is it's not just the cost to the friends and relatives and all of that in terms of, what they experience, but Diane had brought up a really great point too of most older adults, or many of them that we work with or that we all know, are active still in community, in their communities, and they're contributing all the time to society. And if there's a fall and an injury that occurs, that halts a lot of that, and sometimes removes that person from those committees or those groups, churches, community agencies. So, that's a huge loss for society and the community too. So we want to prevent that from happening.
I would like to offer a couple of tips for practitioners and for families, particularly with folks who've had assessments, who have relatives without having had the assessments, particularly those who have some amount of dementia. I have heard from folks that when they received the recommendations from the OTs, that they could get these recommendations done for their, for example, parent, if they moved slowly, if they did one thing at a time. For example, rather than saying, we have to have grab bars, Mom, we have to put in a ramp. One woman said to me, do you know how I started with my mom? She said, I was in the kitchen and I said to her, I'm going to get a taller garbage bag, a garbage can from my kitchen. Can I get you the same kind? Because the taller can wouldn't require the mom to stoop over and put her at risk for losing her balance. And she said, I've been able to slowly go through the list of recommendations because I have been patient. So patience, small steps are frequently what are needed in making home safety assessments recommendations come true.
Okay. Any questions or anything we can provide? We're on if you look up Age Better online, you can see our website and our contact information if you'd like any materials or anything that we can offer if you're interested in an assessment or in learning about maybe how that could be put together in your community. That would be great.
And if you have tips to give us, ideas, questions, suggestions for assessments and research and perspectives, please share them with us.
I'd be interested to hear from others here on the call what your experiences have been. Have you had an assessment done? Are you doing them in your area? I'd love to get a little discussion going here if you have time and willing to bring that up. Anyone?
Quiet group.
Kind of a quiet group.
Oh.
So in the chat,
yes,
we've got that says, do you present this information in the community, for example, for groups of volunteers who visit older adults?
Yes, we go to neighborhood centers, we appear at fire stations, we go to senior groups, we do that.
I'm going to reach out there, and I noticed that Jess Lex, a local realtor, is in the group here. Jess, what kind of situations do you run into when you're working with older adult clients? Okay, get you to unmute there. Oh, you're in a library.
Oh.
Oh, I'm sorry. Libraries aren't supposed to be quiet, you know. Light them up with some scintillating conversation. Anyone else while Jess is getting into a conversational position? As Felicia's out there, anyone who would care to offer a comment, that'd be great. Okay, Jess, I see you're unmuted. Excellent.
Yes. So I attended because I meet with a lot of people who intend to stay in their homes for very, very long times. It doesn't always work out that way. But I definitely just wanted to get the information so that I'd be able to put you folks on my resource list to pass along to people
Right.
who might need that to help them stay in their homes if they don't plan to make a move. But yeah, I see quite a variety of situations, and a lot of folks want to know how they stay in their homes. So I don't know if that answers the question at all.
No, it does. Do you have, I mean, the people when they're buying, if they're buying a house, do they worry about, the cost of renovating so that they can stay in that house? Not a lot of older houses that are affordable simply need renovations. And so, getting the assessment was one thing, getting the remediation done is something else. Do we have any
Yeah, if you've
local
ever heard the
program?
cost of upgrading a bathtub to a walk-in shower, it's pretty steep,
Yeah.
just as an example.
Actually, in
Yeah.
our area, Jess, we have a person who has a business that provides a step through, like a little door to get into a tub. So it's a lot less expensive. And one of the things I didn't get a chance to tell you is that the OTs leave not just with providing a paper copy, the recommendations to the participant, but with a folder that contains all kinds of resources, including a list of vendors who can do these kinds of things, various kinds of services. So I see we've got other folks who want to comment, so please do.
This
Go
is
ahead.
Ruth from Racine County, and I work at the ADRC here. And when you're talking about that cutout in the bathtub, I have to say my mother-in-law lives independently. She's 98 years old with macular degeneration. I say independently because my sister-in-law and her family live next door with much supportive help. But my husband and my brother-in-law did that to her bathtub. Went on Amazon because I told him that it was possible. So he researched it, went on Amazon, and they have some, home maintenance skills. They're pretty good with a tool. So my husband watched the YouTube video on how to adapt the bathtub, and they were able to cut the hole, modify the bathtub on their own, and it was relatively inexpensive. So, if you know somebody that is a handyman in your area, or somebody in your family, it is doable. And she gets in and out of the bathtub confidently. So it was a great fix because we
Excellent.
wanted to do a bathroom remodel and she didn't want anything changed other than the bathtub.
Excellent. That's great information.
Yeah. Who knew it is on Amazon?
Yeah. I was going to mention too, when Jess was talking, it made me think about another topic that we bring up with a lot of the participants is, and it's not always something they're thinking about, is it's not only for you, it's making your home accessible and safe for other people too. So we want to encourage, obviously, isolation and loneliness is a huge problem with older adults, especially if they're living alone. And we want them to invite other people over or have neighbors come visit or the bridge club or whatever. And so often people are only thinking about their own, I know where that cord is. I know that rug is kind of slippery. I don't need to change anything. I know about it. But, it's thinking about people who are coming to the home or want to visit and making it safe for them too and accessible. So it's just something to bring up and suggest, and it might encourage someone to make some changes. Any other
We can't hear.
comments or?
Yeah, please join in, everyone. Love to have your comments.
I don't
Hi,
want to
Mike.
monopolize, but Racine County works with local EMS departments.
Mhm.
So I have a referral in my hand that I just have to go out to do a fall assessment. So we haven't had as many referrals as we would like because people are embarrassed of falls. There's many reasons they don't want to have a fall referral to us, but it really does give us that same opportunity as you to go into the home and make suggestions.
That's why my focus today was on the fact that you don't live alone. I mean, you fall and look at all the things that happen. So they may feel uncomfortable about their home situation, but the point is they're connected to other people. Other people depend on them. Other people love them, right? And so if we could change the conversation, I'm not alone. I'm just not one thing. I mean, if we stop in this culture, we quantify things, we put things in categories, and in fact, life is a blur, it's a blend, it's like a river keeping going. And so if we could shift our attention to the wider community and how any one particular person is involved with and affects other people, that takes the onus off of them. So one of the things that we say is, you keep your house safe because you're not the only one who comes in there.
Very true. And, when we talked about that 50 billion in medical costs, that doesn't count all of the other, ancillary costs. I mean, the kids having to take time off, maybe even quitting a job to take care of a parent that's fallen. I'm sure we see plenty of those among the professionals who work in this area see this every day, I imagine.
And you've got people in the sandwich generation. They're taking care of elders and they're taking care of their younger kids. So it gets to be a lot more complex than what we at first blush anticipate, to use an old expression, but I can because I'm old.
We didn't talk much about the recommendations, and we want to mention as well, there are some recommendations, obviously, that will be costly, or, the purchase of equipment or grab bars or the carpentry costs. For some individuals, that can be very challenging, and we are very fortunate that we have just this year received a donation from a family foundation that will help provide some of that with some of our participants, and we always make sure people are aware of that. We don't want it to be an obstacle to making changes that are needed or getting equipment. There's a lot of loan closets in most communities, so we definitely tap into those as well. But if you were starting a program like this, it's always nice if you can create a fund. It doesn't have to be huge, but just something to help support if it's not already available in your community, so that people who need to make changes can make those changes. We can't do like $30,000 ramps, but we can help with some of the carpentry costs or some of the grab bars, things like that.
Any other questions for Anne and Diane? Great chance to.
Thank you.
Thank
And
you
if
for
not,
having us.
right. be sure to get in touch with Diane and Ann if you have questions. You know, they're great people to work with, and I just can't say enough about working with Age Better, Sale, the entire group, Safe at Home. Really a good bunch of people. All righty, everyone. Well, thank you very much for joining us today.